Hey kids, it's Bill the Knee Pain Guru. Today is Monday, November 16th, 2020. We're going to dig in today. We got some questions that have come in. It's been a few days. Life's been busy, so here we are. We have some questions about ACL reconstruction, meniscus tears, and Baker cysts. So we're going to dig into those. These questions have come in over the YouTube channel as well as the Knee Pain Guru website. So if you want to check out more, you can head on over to kneepainguru.com for more information. If you have questions, you can type those in the live chat and I will address those here shortly. We're going to slide on over to the questions right now. This first question came in from Terry. This was on the Knee Pain Guru website. Hello, I'm searching for the right path to take in regards to my left knee. MRI findings, complex tear of meniscus, mild arthritic changes, large leaking Baker's cyst. I've seen an orthopedic surgeon and a rheumatologist. Arthroscopic versus total knee replacement, draining Baker cyst with Depo injection, CTC. I'm not familiar with that. However, I can't walk downstairs, so difficult to bend and some swelling. Is surgery imminent as the meniscus won't heal of no blood supply? Hey, baby, turn that down. I'm a 63-year-old female and was an avid walker most of my life. I believe my meniscus was torn when my dog turned to chase a cat. I was walking her and fell. Thank you. Well, here's the deal. Like if you have a situation like that, there's a lot of dynamic things that are going on. Evie, turn it down. Just in case this isn't pre-scripted. We're still doing the remote schooling, so we're working with some stuff. Okay, Baker cyst, complex tear in the meniscus. We're trying to figure out the strategy. So the question is arthroscopic versus total knee replacement. Total knee replacement, that's going to be that extremely abusive surgery. You'd always want to save that for last. Because they're essentially sawing off the bones in your leg and replacing it with plastic and metal. So if we can avoid that, probably you want to hold off on that as long as you can. What can be done as far as a strategy is looking at an arthroscopic surgery with the meniscus, seeing as far as, let's see, it's a complex tear of the meniscus. So we're going to need to look at the direction of the tear, the degree of the tear, and the location of the tear in order to determine if the complex tear, the doctors would essentially trim it up enough so it's not going to be catching in the joint, because that's what ends up happening with a complex tear in a joint, is it actually will lock up the joint. It's like putting a doorstop in, your door jamb. So it makes it difficult for the knee to extend and bend, and it's kind of flapping around, so you never know when that's going to catch. My strategy for this, if this was me, once again, this is something you got to check out with your doctor and or your physical therapist. But if it was me, what I would do is see what I can do with research the degree of tear, the location of the tear, the direction of the tear, and look at how I can do an arthroscopic surgery to clean that up enough so we would have, and that would be the medical approach. Now we're looking at a natural approach, which is how can we set up the conditions so the body can begin to heal what's going on, to reduce the pain, to heal what's going on in the knee, because I believe your body has the infinite capacity to heal itself. The tension patterns that are going on that are contributing to the Baker cyst. So that would kind of be in the order. Let's see what the doctor says as far as doing an arthroscopic surgery to clean that up. And then let's start setting up the conditions in the body to reduce the pain and allow the Baker cyst to resolve itself. And then seeing where you're at. Because knee replacement is always an option. And once again, it's really a brutal surgery. So in my estimation, I would want to avoid something like that until it was absolutely necessary that that happen. And once again, it's a brutal surgery and you can't undo it. So that would be my strategy as far as the path to take regarding a complex meniscus tear with a leaking Baker cyst and mild arthritic changes in the knee. And I would do that as soon as I could. So I would get moving as soon as possible. If you're liking the video, give it a thumbs up, like and subscribe to the Knee Pain Guru YouTube channel. Turn on notifications for future videos. If you have questions about your knee situation, enter those in the comment section, and I will address those shortly. And until I see any of those, I'm going to move on to the next question here, which is from Miss Cam. Hey, my name is Kameron. I know you probably answer these questions all the time, but I recently had ACL reconstruction and meniscus repair surgery. So did I. Mine was 21 years ago. Yours was just in October of this year. Now it's November, and I don't think I'm making the progress that I should. I hate going to the physical therapist because she literally has been forcing motion on my knee since I started seeing her. Yes, that is their strategy. That's what they're there to do, is to force the knee joint. They're looking at it very mechanically. They're looking at it anatomically, and they're getting your knee joint to do something that it doesn't necessarily want to do because there's tension in the joint. Your neurology has been affected. It has essentially been a trauma, both the injury and then the subsequent surgery, and then you go to painful physical therapy. From a common sense standpoint, this is not necessary. This shouldn't be a surprise. However, here we go. So yes, my tension is at an all-time high when working on bending and recovering because the body is tensing up to protect itself. Understand it from a neurological level. If I'm walking up to you and I'm going to cause you pain, you're going to tense up. You're going to be afraid. So you know the physical therapist is coming over there to bend your knee. You're going to tense up and be afraid because you know what's coming. So we need to get to a deeper understanding and a level of awareness that's going on in the knee joint, in the body, in order to get it to bend more and recover faster with a fraction of the time, energy, and effort that you're currently putting in. Okay. I like using the resistance bands, but it's becoming so discouraging seeing recovery stories of people flexing 90 degrees after the first week. I'm almost in tears. Please help. What do I do? I already outlined that. We're looking at neurologically rewiring the knee. Now, why some people can get 90 degrees flexion out of the knee after a week and other people can't, that's not something that I'm able to explain. Everybody's wired differently. We're all unique human beings. However, what it's important to understand that the more the knee joint feels threatened, feels pain, feels tension, and has that all stuck in the neurology, our brain, spinal column, out into the nerves, into the body, we have to understand and look at it as like, when they talk about PTSD, it's trauma. PTSD is trauma that's stuck in the neurology. It's the same thing for some people when they have a knee injury, that they're not getting the range of motion, extension or flexion. It doesn't matter if you had a surgery or not. It doesn't matter how long you've been in pain. It doesn't matter your age. Your diagnosis is irrelevant of your body's ability to let go of tension and stress. Apples and oranges, two different scenarios. And a lot of times your body's ability to heal what's going on is going to be limited by what's going on in the neurology. And unless we address that, the neurological signaling, creating comfort, this is what we do in the Knee Pain Guru program, is we look at how to create comfort to diffuse the tension in the nervous system, reset the rewiring in the knee so the range of motion begins to increase in the joint almost instantly, because we're working directly with the reflexes. The reflexes, just like when the doctor taps your knee with the hammer and your knee jumps, you don't control it. Those reflexes are firing in our body all the time, or not firing because we've blown a fuse in the neurology, not allowing the knee to fully extend or fully bend. And just talking about the knee is a little bit limited in scope because this affects the entire body. The rest of your body has to protect what's going on in the knee. The knee holds tension, the hip holds tension, the lower back holds tension, the hamstrings, the quads, the shins, the calves, the ankles, the feet. So when you walk, you're limping. It's affecting your entire body. Your body gets fatigued. You get frustrated. You get tired. And what ends up happening is you're running into this limitation. So what you can do, on the other side of this video, you can head on over to the Knee Pain Guru website. I have a video on the homepage you can watch to begin to learn about my approach. Because what's most important about this approach is that we have to have a different mindset going into the rehab, going into getting the full range of motion, extension, and flexion, reducing pain, stopping your body from limping so you can walk normal again. You have to have a different mindset, which includes you don't have to hurt to heal. You can get out of pain without going through pain. And that's a big mindset shift because it's kind of been hammered into our head that no pain, no gain. Pain is weakness leaving the body. You got to push through the pain. So that's what I would suggest. Head on over there. If you want to get involved, I have a group coaching program called Knee Club. I do private coaching with clients. There's lots of options over there that we can get you out of pain with. Okay, next question here is from Bill. It says, what are your qualifications? PT, Chiro, MD, nothing. Some guys selling quack pain programs online. Bill, I get it. I get it. And no, I'm not a PT, a Chiro, or an MD. However, I have had extensive training in an osteopathically based style of bodywork called orthobionomy. I've also had a good 20-some years in martial arts and studying movement. So I'll give you a pass as far as your ignorant comment. However, if I was going to sell quack pain programs online, there's a lot easier industries to help people in than knee pain. But most of the time, when people actually listen to what I'm saying, it makes sense. It lands. And it's not because of the number of degrees or my qualifications or any of that, because there's plenty of people in pain going to those people that have the degrees and the certifications and all of that other stuff, and they're still in pain. So it's a call to authority it's a fallacy. That if there's information that can help you get out of pain, I'd take advantage of it. And we have this incredible tool for the internet that no one is forced to get into any of my programs. That's why I'm educating people here so they can see that there's a different way. Because most people will continue to suffer in pain for weeks, months, years, and decades while their knee joint wears away and they can't get answers from doctors, chiros, physiotherapists, MDs, and they think that's the only option. And they're led like cattle down this path that their knee joint continues to wear away with arthritis and pain and stiffness until they think their only option is to have the bones in their legs sawed off and replaced with plastic and metal. I'm just here to give people another option. Whether they choose it or not is up to them. That's what makes what I offer great, is that the people that it doesn't resonate with, they can click off the video. It's no big deal. And those that it does resonate with, I got pages and pages and pages of testimonials of doing this online over the past 12 years. 21 years worth of experience underneath my belt since my own knee injury. So check yourself, Bill. Okay. Anyways, next question from Cuba. I would appreciate any suggestion for my rehabilitation after knee arthroscopy. I am 10 days after the meniscus tear operation and the knee heals well, but on top of that, I still have a Baker's cyst. So this is similar to, what's her name, Terry's situation. The swelling from the knee is almost gone, but the cyst from the swelling comes and goes in waves. One day I can be almost perfectly fine, swelling approximately 10%, the other day 100%, causing walking trouble, extending a leg, still trying, applying cold foam roll or knee sleeve to all various effects, always ending up in the same place. Is there something that I can do to work on my problem? Yes, changing the neurology in the knee. That's what I found is the fastest and easiest way to allow the body to heal, the knee. It's important to understand that when you're looking at after surgery is a trauma, and got that. But there's two elements that are going on at the same time. One is the physical healing of your body. The other is the neurology. The neurology gives the signals to the physical body. It tells the body the muscles to fire, the tendons, the ligaments, the fluid. Everything functions as a result of the signals it receives from the neurology, from your nervous system. So when the tension in the neurology from stress, from pain, from trauma, whatever it is, tells all those other things to tense up or relax, which is why some days you'll feel the pain be worse, and others the pain's better. Some days the range of motion is worse, some days the range of motion is better. When we look to the neurology and get the neurology to feel safe, supported, listened to, the neurology can relax. The healing ability of the body to come online and heal the physical part is going to speed up. The recovery is going to increase. So that would be the strategy that I would look into. There's a lot that goes into it in terms of changing the neurological signaling in the knee, looking at water, nutrition, breathing, mindset, stretching, mobility, strengthening. There's a lot that goes into all of that. We lead with comfort. Is your fastest way out of pain, your fastest way for your body to heal is through comfort. So, okay, Cuba, there you go. There's your strategy. You can head on over to the kneepainguru.com website. You can check that out. The program that I help clients with is called Knee Club. You can check that out there. Make sure to give the video a thumbs up, like and subscribe to the Knee Pain Guru YouTube channel. Turn on notifications for future videos as we do these several times per week, answering your questions. If you're watching the replay, make sure to leave your comment. Okay, I got a short little clip to let you watch as we're scooting here. Thank you so much. Make sure you watch this. This is Bill Paravano, the Knee Pain Guru. Thanking you so much for being here. I appreciate your time. Have a wonderful day, and I will see you on the next one.